My name's Dave Horsfield. I'm the Programme Manager for Liverpool Clinical Commissioning Group for the MI or More Independent Programme. The programme is generally about the use of technology, but more importantly about how we put that technology together in services and how it goes out there to communities, how it engages with professionals and how actually it makes a real impact at scale. Our approach to commissioning on the programme has been very much around using technology as a tool, not focusing on the fact that it is technology or changing the way that we want to do things because it's technology, but actually focusing on what is the outcome that we want from the use of those tools, which is essentially what technology is. So that means we have to focus on what our professionals do, what our community need out of it, and how those tools really reflect what they need, rather than focusing on the fact that it's technology or that it comes off a shelf and it has to do certain things. It's more about what that technology has to achieve and how we bend the technology to what it needs to be, rather than focusing too much on the technology itself. Some of the key challenges that we found when trying to roll out technology in our services has been attitudes of the public. So we can start with things like people deciding that technology somehow replaces the physician or the GP, or that they'll get less quality service because they're not going to get in contact with human beings. And really that's a reasonable thing to assume if you don't know what that technology is for or how it goes about. So what we first found with our public was actually we need them to understand what the technology is there, how it's going to be used, and how it's a benefit to them. What does it mean to them? Because if they as service users don't want the technology, why are we buying it? Secondly, it's about professionals. They are the people with the skills, they are the people that people need those services from. So the technology has to reflect their wants and needs as well. We've got two really key groups. We've got the public and we've got our practitioners. This technology and how we buy it, how we roll it out, and how it serves those two particular groups is fundamental. Otherwise, the technology simply doesn't get used. Again, it's a tool. The tool has to be useful for all of the people involved. Fundamentally, we see telehealth and telecare type technology as very, very useful towards the bigger self-care agenda. Essentially, it allows, first of all, our patients, the public service users, to get fundamentally a much better grasp of how they manage their own condition. They start to see their own vital signs and what that means to them, and how they can really start to understand and drive their own health and take some responsibility for that health instead of passing that on to other healthcare professionals. Secondly, it allows us as a health care profession to really start to drive intelligence-led healthcare, which is around understanding when our patients need our help and what help that is at the right time in the right place. This kind of technology really starts to give us that day-to-day feedback that allows us to drive those technologies, and then we can start to see not only efficiencies in our service, but most importantly, how we drive forward the quality of what we're delivering to our patients. The MY programme was funded by the Technology Strategy Board, or now known as Innovate UK. Its intention was to be a forerunner, to find out some of the answers to starting to put technology to use at scale. And what we found as we've done that is that we found that we've had great feedback from our patients and service users. They're not just finding a way to use the technology themselves, which is not really shouldn't be surprising, but actually they're finding that they have more choice in the services that they use, but most importantly, they're actually using the technology to decide how they can live their lives. They're using that information to start to generate their own way of self-caring. Going forward, the MY programme really wants to look at how we start to pull technology and service together as one. So stop thinking about technology as something that we bolt on or add into services, but actually it is just the everyday tools that we start to use to get services out to our patients, to our service users, but at high quality, but at scale. how we can really start to get our services to be intelligence-led, that we drive them right service, right place, right time. Technology can help us do that and really drive up quality. Then, and only then, we can start to look at what the efficiencies might be of that. But really, our focus at this point in time is the effect on patients, how we can really give the right tools to our professionals going forward. And if it's cost neutral or better, then it's a huge success for us.